Medical therapy is not just an important adjunct to maintain your existing hair after transplant, but it's also an important therapy to start even before transplant. I have many patients who do medical management only and don't do transplant. It may seem counterintuitive to think that you contact a hair transplant surgeon and you're told surgery is not the best option for you. I take the approach that surgery is the last option. There are many medical therapies that can truly improve what you have and certainly stabilize your hair loss. And I've seen many patients, men and women, who had substantial improvement. The miniaturized hair started to shed and then came in fuller. So I think this is worthwhile for most of my patients to embrace medical therapy. Obviously, there are exceptions in which surgery is the right option. Certainly, medical options do not bring all the hair back, but it can certainly be a useful adjunct. So one example of the things I typically recommend is a extra strength minoxidil lotion, which I prescribe via a compounding pharmacy. The lotion minoxidil is a better texture than the topical liquid or the foam that's over the counter. At least I find it to be a better texture. It can also include whatever additional therapeutic ingredients I choose to add. Typically, I'll add a low-dose topical progesterone, which helps to block the ability of DHT to bind to the follicle, to the hair follicle. Often there's a low-dose retinoic acid, which is an exfoliant common in a lot of cosmetics. We will sometimes add a low-strength hydrocortisone as an anti-inflammatory. And interestingly, sometimes we add topical finasteride. Most patients have heard of finasteride or Propecia. It is available as a tablet. It's been on the market since 1993, I believe. It is also available now as a lotion by prescription. And so patients who are a good candidate for finasteride but are reluctant to take a tablet, finasteride lotion can be used in conjunction with the extra strength minoxidil. Ideally, even in the context of the most successful transplant in the world, patients embrace medicine as a continuous means to keep what they have.